So next we have that which precaution has not been shown to reduce the risk of HIV transmission during surgery. Would it be gloves, double gloves, protective eyewear, laminar flow ventilation, or surgical mask? So, out of these, there is one feature which has not been associated with the decrease in the risk. However, rest are the parameters which should be upheld to prevent the HIV transmission. So, 8 hours after anterior resection, a 72-year-old man develops a temperature of 38 degrees. He is otherwise asymptomatic, pain free, with quiet lung basis. So, what is the most likely explanation? So, again, establish the time. So, it is 8 hours, that will be a 0 post op day. So, would it be an epidural abscess, a systemic response to surgical trauma, basal atelectasis, infective exacerbation of the COPD, or urinary sepsis? So, you are being tested with the specific number of day against the fever, that is pyrexia. So, again, postoperative pyrexia is one of the high yield topic for any surgical exam. So, in this scenario, our answer would be the systemic inflammatory response to surgical trauma. So, there are two things which we need to establish before answering post-operative pyrexia. That what is the time? So, the most important thing is the time duration, and with respect to that time, which system is going to be at most risk. Now, at 0 to 24 hours, which is in our scenario, though it will be the wind that will be affected, but the most important reason for that is the surgical trauma or inflammatory response. Mostly just observe because it is physiological. Then, for the first to third day, atelectasis and aspiration pneumonia are the most common thing for post-operative fever. Now, what is going to be your management if you're tested for that? You will be given chest physio, spirometry, and oxygen. Now, from the third to fifth day, water, that is the UTI from catheter. For that, you will take the urine dipstick and send it for culture, and you will start specific antibiotics depending upon the report of the culture. Then, if the patient developed fever at 5th to 7th day interval, that will be because of the wound infection. Now, that will be labeled as the surgical site infection, and one of the most common organism for that is the Staphylococcus aureus. Now, what will you do for that? You will inspect the wound if there is any discharge, because that discharge will help you quantify the surgical site infection through the Southampton score. Then you will take the swab and send for the report, and you will start antibiotics depending upon that report. Now, if the patient develops fever at 7th to 10th day, then it will be associated with walking. That could be because of DVT or pulmonary infection. And for that, we have the ultrasound Doppler and CTPA specifically to rule out the pulmonary embolism. Again, depending upon the status of the patient, whether the patient is stable or unstable after pulmonary embolism, we can start the patient unstable with the low molecular weight heparin. But in this, we might be required to perform the embolectomy, followed by giving the patient initially heparin and then shifting the patient to warfarin. Now, wonder drugs or IV line drug infection can be at any day. So that is very important. For that, you will have to review the medication and change the cannula. So less than 24 hour, it is surgical trauma response, which is totally physiological. It is not an infective element. Then we have the wind at the 0 to 3rd day, then water from 3rd to 5th day, then from 5th to 7th we have the wound, and then from 7th to 10th we have the walking. So atelectasis can happen between 1st to 3rd day, but it is very less likely that it is found on the 0th day, which is in our scenario. So it is high yield to first of all establish the time, then think about the system, and then think even that can that be a physiological response, or it could be associated with certain established pathology. So that is your algorithm to solve the post operative pyrexia.